Hello, welcome to HLA Live. HLA Live is our regular broadcast on the HLA YouTube channel as well as all the other social media channels. Each week we talk to interesting people from across the HLA community.
Good evening, everyone. I am really excited to be chairing tonight's meeting.
Hi, I'm Rosie Spooner and I'm hosting HLA Live this Wednesday.
And I'm an HLA scholar and I'm also going to be your host this evening.
To share with us their ideas and their innovations and hopefully bring them to a global audience.
Quite quick, we have ideas, let's do this, let's do that. So
many of the topics come from our community, with scholars and faculty expressing an interest in many of the discussions that we're about to have.
Hello everyone and welcome to the HLA Live session on widening participation in the postgraduate realm.
Homelessness and health.
Addiction and the new normal.
HLA programs are built on 6 pillars. The leader is an innovator and entrepreneur. The leader is a communicator. The leader is a manager. The leader as a negotiator. The leader is a follower, and the leader is a philosopher. If you are interested in becoming a HLA scholar, why not get in contact? Many of the episodes in HLA Live will cover one or more of these important pillars. The HLA team consists of Pedra, Eamon, Tim, Riddy, Alistair, Adil and Trisha, and a range of other HLA scholars and faculty.
Welcome to Build a Leader. This is our special live episode. This is normally just the HLA Listen podcast, where we discover the building blocks, building the people driving society, with Med.
Hi.
And Nandi.
And hi.
Who are my friends and we were fellow scholars of the HLA program. Today we have a special episode where we're interviewing a leading expert in digital health and leadership.
So Mr. Chaudhury is lead on digital health for Healthcare UK at the Department for International Trade, which he does as well as his pro bono work, which includes championing the hashtag Future NHS Data and Analytics for COVID-19 workstream and mentoring for SIMDH. So welcome, Mr. Chaudhury, and thank you so much for joining us today.
Thanks, guys.
Now, firstly, we just wanted to ask you, well, I've been curious really, as a data specialist in your field, was adjusting to the digitalization of the world a difficult thing, or was it something that you have seen coming? You've been, a lot of what you've done in the past has been digital for a long time, and you know you've been asking us to move this way already.
So I've got an unusual background, which I'm sure we'll get into, but also I'm of an age where I'm neither Generation X or a millennial. I'm a zennial, right? And the reason I mention that is because people who grew up in their childhood with analog books, but their teenage years were digital, that transition taught us a lot. And that age group, which is basically being born 77 to about 81, that kind of age group, that set of people treat digital very differently to those before them and after them, because they've seen a bit of both, right? So I know how to use one of those old-fashioned telephones, right? I'm one of those guys. So to me, digital isn't the only thing I've ever seen. I can remember a time when a mobile phone was this big, right?
And not particularly mobile.
Oh, of course, yeah. Car Phone Warehouse was actually selling car phones. Like that was me, right? So data for me has always been a byproduct of this digital thing, because I've seen what it's like to not be digital, and I'm used to that. I actually have enough of a lifetime on both sides. So for me, I am a passionate advocate for how we need more digital and more data. And I can see the dangers. I can see people who treat digital too lightly, maybe about using your social media profiles and not realizing that they're going to be there forever. So when I look at digital, I see it as essential. I really do. I'm not against it at all. I'm for it. But I do wonder whether we've gone too far sometimes. So that's the position that people of my generation would think, early 40s.
Does it worry you how people take it so lightly. I think for my generation, being digital is something that we've completely been inaugurated in almost from birth. And, you know, I think it's now at least easier for me to pick up an iPad or a phone than it is for me to concentrate reading a book. And you know, our attention spans have changed as well because of that. And, you know, is it something that worries you, having come from a generation where things were so different, or do you think that we're moving in the right direction?
I want to say that we're moving in the right direction, but we're moving too slowly. Look at healthcare, right? Only recently have we managed to axe the facts, right? Which was a big campaign that you saw out of Leeds.
Yeah, huge campaign.
And bleepers, right? We've got this promise of a paperless NHS, and we've been talking about going paperless since the 70s. Like, companies have been saying, yeah, don't worry, we'll be paperless soon. And it takes ages. So in some places we're going too slow. But on the privacy side, which is, you know, the Facebook argument, the GDPR argument, when it comes to citizens' rights, perhaps we've gone too far too soon. So there's a balance. But in healthcare, I want to see more digitization. And I think that there's lots of people who are blockers. And those people who are blockers, they don't see the point of digital. What they see is the bottom line. And this is a big conversation, but to be clear, when COVID happened, most of those blockers weren't at work. So we saw lots of acceleration and change. And the problem is they're back at work now, so it's slowed down again. But the NHS is full of those people, and health systems around the world are full of those people who block digital. I want to make that change.
How do you balance these, you know, privacy, citizens' right questions with then, you know, asking people for, you know, an increase in their most personal data, you know, being their healthcare related data? How do you, because it seems like quite difficult to balance these two ends.
Fantastic question. So there's two problems. One, we pitched the question wrong repeatedly. And to give you an idea, what do you trust most? Your bank or your GP? Right? Your bank has a lot of information about you. I think Tesco Club Card has a lot of information about you. Right? Yeah. In order to get those air miles, which used to be important, I mean, COVID-19 has now ended that, right? People are going to cut up those credit cards. But there was a point where you would have put whatever information about yourself. Yeah, this is my annual salary. This is my age. This is the ages of my kids. People were throwing that information in because they wanted to be in the draw for that PlayStation, right? They wanted to be in there. But when it comes to medical, everyone's worried. Oh, what could go wrong here? So it's been pitched wrong. The second thing is that we haven't done a very good, if you like, we haven't done a very good PR job of explaining that data saves lives, which is why the Wellcome Trust and others have been working on this program of understanding patient data. And we need to make sure people realize it's not all about analyzing the data to reject your insurance claim. Right? That's not why we want your data. Right? We want it because we want to cure cancers. Right? We want to identify hotspots for communicable diseases. Right? COVID is a very good example of that. If we don't have that data, we don't have the patient registries, we can't do the real-world data analysis, we're screwed. So not only have we pitched the question wrong, we've not done a good PR job.
So I think that's the first time I've heard it phrased as data saves lives, which I think is a really interesting way of thinking about it.
I wish I came up with it, Nadi. I wish it was mine.
You should have just taken it. In this moment, it was yours. But do you think now, with everybody sort of on board, or most people on board with sort of track and trace and all these other things that are sort of using, you know, accessing our health data, that we're getting to a point where the PR is changing around that?
Look, I wear a government hat 3 days a week. So I have to be very careful about what I say about the government. Right? You ready? Yeah, for what's coming next?
People often say that anything that comes before the word "but" is not as important as what comes afterwards.
Med is fine. It's fine. Just take both for this one. I think that the government handling of the crisis, the pandemic, has been caught out repeatedly in surveys. So this isn't my personal opinion. This is something that's quite commonly accepted now, that the public confidence in the way that we've handled the pandemic isn't as it should be. And there's some of the arguments are to do with how we've not communicated or we've changed the communication. Sometimes the plan is to eat out to help out, right? Sometimes it is to stay at home. Whatever the argument is, we are in danger of actually losing trust in what we do. So we must be careful at all times to make sure that the value of medical research stands separate to all of the politics of the day, to anything that can get in the way of it, because it is important, it is valuable. And without it, a lot of the data-driven technologies that we have die immediately. There's no way, for example, just I think this morning there's been this report of a new way of checking people have COVID with audio of their coughs, right? So how did you get the data on those patients coughing when they had COVID? And how did you get asymptomatic recordings? And how did you do the machine learning for those? That's data, whether you call it an audio file or an X-ray or chest X-ray, whatever it is that you're looking at, this is all data. So we need this data for innovation, for advances, and we need to protect it. And anything that damages confidence, public confidence, is a no-no. And we made a mistake a couple of years ago with something called care.data, which was an attempt to gather people together to the idea, to the public buy-in, that we were going to have data collected for research. And it went very badly wrong. If you Google it, you'll see. We can't have that again. So that's something that I think is worth keeping in mind at all times. We are not actually at perfection. We're always 5 minutes from disaster when it comes to losing patient trust.
I think that's a very thought-provoking opinion, and thank you very much for sharing that with us. You mentioned that the public confidence is not as it should be, and I don't think that that is a controversial statement. I think that is a commonly accepted statement. I wonder, as our theme for our conference today is leading through difficult times, and of course the government was in a difficult situation and having to deal with things that it hadn't necessarily expected to deal with. What do you think could have been done differently in terms of how how things were dealt with that would have changed how the public has seen and accepted things coming forward?
There's a couple of things, and I'm not alone in saying this, that we should have learned the lessons that other people, especially across Southeast Asia, China, and other countries that had experienced SARS, for example, had all experienced, and there were lessons there. Hollowing out investment into public health and pandemic preparedness is always going to be a false economy. And with hindsight, looking back, that seems pretty obvious, right? But at the time, none of this is really being picked up on. I think there's another problem where the public wanted reassuring messages, and the way to give reassuring messages is to be consistent. And unfortunately, no matter what happened, the evidence that is presented to the government isn't always the same. It's sometimes contradictory. So SAGE is offering one type of advice, and even then there's dissenting voices within SAGE. Then there's Indie-SAGE. And then there's other people outside of that who are saying, for example, let the virus rip through communities and build herd immunity, or only focus on those who are exceedingly vulnerable. There's lots of these arguments out there with very substantial people on each side. The government has a very difficult task. And I don't have any criticism at all for the government. Looking back on it, you can say, yeah, you should have done. Don't know how I would have done in the same situation. But consistency of messaging is clear. And I say that because that's important in any leadership role. Whether you're managing a small team, whether you're leading a big corporate, whether you're running a hospital, if you are inconsistent in what you say and how you say it, people will lose faith in you. People will not trust you. whether they're easy times or difficult times. And I'm afraid consistency in messaging, which should really be strong for politicians, hasn't been strong so far in the pandemic.
And
Sort of.
yeah, sorry, tonight, there you go.
Yeah, so I was a bit curious following on from that, particularly with your data background and talking about trust and consistency. What do you think the relationship is with when things are so complicated? They involve risks and statistics and things like that, things which the general public aren't, it's not as easy to grasp necessarily. How do you think that changes in how you communicate with people?
So this is a philosophical point, and that's drawn from many years of, I think, trying to apply my own ideas about leadership and sometimes failing miserably. I think, and this was said to me by a good friend and mentor years ago, leadership is that when everything's dark, and you can't see what the right answer is, and somebody in that group shines a light and says, go that way, and everyone can see it. That's leadership. That's what it really means, right? When you are clear about what you are saying, everyone can see your message and you can lead people towards it. Of course, there are elements of leadership which are about yourself. Do you have integrity, right? All those are issues. But if you can't point in the right direction with evidence or data or something to back up that argument, if you can't do it, you can't get leadership. And if you keep getting it wrong, you lose that leadership. So eventually you will lose that leadership if you don't make the right decision. So deep down, leadership, if you know where to go and you can prove that's where to go and people will listen to you, you're the leader, whether you have the title or not. And unfortunately, sometimes in organizations, and I've been in those organizations, the person who's supposed to be in charge isn't really. We're all looking at someone else who's saying, no, this is the way to go, right? That's leadership. Leadership flows to the one who knows.
I think we've always been, we've all been in that situation before. Even and there's popular culture references as well. And I think about Lord of the Rings. Aragorn was the king in Helm's Deep, even though Theoden was supposed to be the leader. It's a common conception, I think, that actually someone doesn't need to be given a position in order to be a leader in that situation. Is there any examples in your life that really stick out for you where someone was a leader when they weren't designated to be? Someone shining or outshining the people around them and becoming the leader?
I've been in multiple organizations, so I'm fortunate that no one's going to reverse engineer what I say to work out who this is, right? But there was one guy who was always the one that you would talk to if there was a problem. And he was always the one that would take the concerns of people seriously and give them his time. He'd sacrifice his own time for them. And he would take those concerns privately to leadership to argue on behalf of those points. And he would place himself as a barrier between leadership and the team when they needed to. And without doubt, very, very quickly, people saw him as the real leader of that team. They saw him with the right attributes, the right personality attributes. And integrity is part of it. Honor is another. If you say you're going to do something, do it. Follow through, right? And if you say something is absolutely wrong, and you say this is wrong and this shouldn't have been done, but you don't do it in a way that kills that person. You don't embarrass them in front of people. You do it because there's a concern out of a need to do the right thing for the team and that person. And they can see that in you. You can tell people off as much as you like at that point because it's clear you're doing it for the right reasons. You're saying, you shouldn't do this. This is what you should have done. And that person's not got any skin in the game. They're not trying to make you look bad. It's those behaviors that can lead you to saying, hey, that person cares for us. That person leads. And there's this argument, and a very long argument we can make about what it means to be a servant leader, someone who serves the mission, someone who looks after others. And therefore, not a servant in the sense of being a butler. Would you like some tea, sir? Not that. Serving the mission is saying, I'm going to do what's right. I'm going to put myself on the line to make it happen. And it's not about me. And if you think about really, really good leaders everywhere, they put the mission first. Right? So you've probably heard of Simon Sinek talking about why. Yeah, why is it you do things? Essentially, that's the mission, right? So if you don't have a mission, you don't believe in a mission, it's very hard for you to take leadership. But when your mission is the same as everyone else's, but you really believe in it, and you sacrifice and commit to it, and people can see that you do that, then you're starting to take leadership.
Oh, I really like that, Hassan. I'm that to me appeals as to such a concept of leadership. When people have talked to me about servant leadership before, I've always thought about it as like a concerned teacher. So the kind of teacher who will always, will make an extra effort for the kid who's trying really hard or things like that, because their mission is everyone's achievement. They're trying to make sure everyone does well. They're still in charge and they still, have to control the situation. When people talk about styles of leadership, how do you sort out, the meaningful to the kind of, the fad or the fashionable term that's going around, within these circles?
3 words: strength of ideas. See, I've seen people who are leaders, who claim to be leaders, and they've got charisma. They can make you feel something as they speak. But it gets down to, okay, so but what's the plan? Like, where are we going? And if they throw the word strategy at you repeatedly, but there isn't actually anything there, right? It's all a bit hollow. That leadership will start to fade. There's only so much you can do with bluster, with a bit of pizzazz and showmanship, right? You can be a front person, front man, front woman, all you like, but in the end, your ideas have to stack up, right? And if your ideas don't stack up, that's the end of it. So, for example, if I said to you that we were going to build a business, and this business was going to be making lemonade, right? So you say, okay, decent, let's do it. What category are you going for? You're going for premium, high end. You're making this as a mixer. Like, what are you going to do, right? And say, no, I'm just going to get really cheap lemons and sell it to school kids. I had you there almost, right? And you're like, that idea is so bad, I just can't follow you anymore. Yeah. And that's what it comes down to, the strength of ideas. Now, just say the idea was decent, but I'm not a good person. I'm the kind of person that perhaps will say something and mean another, or undermine you, or talk about you behind your back, or gossip, or be immature, right? Or screw you over. Like, oh yeah, I know I promised you that pay rise, but how about next year? And then I'm walking away with a new Ferrari, right? Those things, because they're divergent, they're not about what I said I was going to do. The consistency is not there. You lose trust in me anyway. So can you see that leadership actually is one of the most difficult things to imagine, because there's so many aspects to it that you've got to be decent at. If you're deficient in one of those, there's no leadership. And that's why people who chase leadership, who say, no, I want to be the leader, I want to be the leader. You ask yourself, has this person really got what it takes? Do they have the humility to listen? Because leaders will make mistakes like everyone else. Are they the kind of people that would say, hey, maybe the idea isn't the strongest. Let's bring people in and test it. And therefore, I don't trust people who chase leadership. I trust people who say, look, this needs to be done, and I don't think there's anyone out there that can do it. And so, because it's necessary, I'll step in. But I'm not a big fan of those who are like, look at me, I want to be the leader, I want to be the leader, me. As soon as that happens, I lose faith.
Do you think you lose faith because you question the why? Sorry, Ned.
I question the who.
Yeah.
Ned, I question the who. Look, if you believe in the mission, and you really believe in the mission, and you do it for the right reasons, that's fine. But there's something wrong I think, with chasing leadership for the sake of it, because there could be someone better. The mission could be served better by somebody else. It's not about you. It shouldn't be about you. It should be about the mission.
Yeah, sorry. I'm really glad you asked that question, Med, because that response, woo-wee. My apologies, I disappeared for a second. A neighbor fell down the stairs, but it's okay.
Oh no, I'm so sorry.
He was fine, it seems.
Okay, good.
Family
Well done,
appeared.
Andy.
I led. No, I didn't. I observed from a social distance. I did want to ask earlier, so as we've been speaking, I think our podcast, as we said, as Tanaya introduced it, is centered around the qualities of good leaders, so the skills that build the leaders and qualities. And you've listed quite a lot of like really important like leadership skills, which maybe haven't come up in our podcast before, which I think is really great. But in this time of sort of leading through difficulty, what skill or what characteristic did you find that you had to develop the most, or did you find most useful?
In my own journey, I've been in environments where people didn't feel psychologically safe. They didn't feel that they could speak up. They didn't feel that they could criticize. They felt they just had to eat it. Okay, right. And you know what that does? That builds a sense of resentment. It makes people feel closed out, that they're not part of the mission. And it means people just back out. So I've had to develop much more thinking around how do other people feel? Because the pandemic has made people feel very insecure, actually. They're not meeting, and there's lots of things that you can misunderstand from a text message when you can't see somebody in person. And I think that's to be very aware of, because there are people out there who, because they can't see you and they can't really judge the body language, they're not involved in the conversations, they're not sure what's going on anymore. They feel a bit locked out. So leaders have to be very careful, especially in these strange times. How do you make people feel comfortable to come forward?
And I guess that would be sort of an enduring difficulty if things are moving digital, if everybody's working from home, if everybody's working in isolation. And I guess maybe how have you found ways to do that, to break that barrier of not being able to communicate with 60% of the communication skills we have?
Yeah, so it's about communicating vulnerability. See, if you keep saying you're okay, and everyone else is going to think, well, now then I have to look like I'm okay. That's not good. You have to communicate that it's okay not to be okay. And that's one of the things a leader has to do, because I think culture, and really leadership is about setting a culture. And culture is something that's very misunderstood. Right? We could talk for a long time. You could have a separate series of podcasts about culture, really. But I think culture is set by leaders. So if you have a culture in an organization where people are late, they don't come in, they don't say that they weren't coming in, you can trace that back typically to what is now acceptable based upon leadership. If people are a little bit, if you like, careful with what they say, not completely authentically honest, the honest friend would tell you that you smell, right? Now, maybe that's too honest for the corporate environment, but you need some of that sometimes, where someone is just going to tell you, well, that was a ridiculous idea. I remember I was with a team, I wasn't the leader, and the team was all really hardworking, so tired after this foreign trip that we had. And we all thought to ourselves we'd do just a meal together, a team bonding thing at the end of this trip, because we'd worked ourselves to death, to the bone, like seriously hard. Like I think one of the team was vomiting partway through and still had to struggle through, right? And the person with the leadership title wasn't coming to the dinner. So I asked this person, not giving the game away here, but I asked this person, we've got the dinner. Wouldn't it be great if you come along, right? And the response I got back is, why would I do that for? I'm going to be doing this instead. I've got some friends in town. And I realized at that point what leadership was missing for that team. And I just did my best during that dinner to be more effusive in my praise for the team, even though it wasn't really my place, because I think it needed to be done. Now, why am I giving you that story? It's because that culture that was being set by that leader, I wanted to actively not just reject it, but to do the opposite. I wanted to push back against that culture because I understand how culture is formed. Because I've tried to form a culture, I've tried to codify a culture with an organization. Right? Because I'm lucky I've been C-suite, I've been a founder. And I think you have to realize what you do inadvertently will set a culture. If you leave early every single day, what are you saying to your team? If you're the kind of person that always grabs the food first whenever there's a picnic, what are you saying to your team? Have you considered how you are coming across? And I tell you what, people don't think about that. And I tell you what, as a leader, that is the most difficult thing, to watch yourself, to think about what you are doing, the misunderstandings and the hidden meanings that people can take from you. That can be difficult.
I love that response at the dinner and the idea of being actively against what he was doing. It's very, I mean, obviously COVID is the big difficulty that we talk about, but obviously there was a massive anti-racist movement at this time as well. And that approach being very intentionally, this is the thing that's happening and I'm going to be the exact opposite. I think that's amazing. Sorry,
Yeah,
tonight I cut you off.
But can I just say that if somebody has a problem with saying Black Lives Matter, then we just should say it in their face. No, Black Lives Matter, right? Just keep saying it, because we shouldn't accept that culture, because people, when they make that statement, and the statement could be as much as not saying it when others are saying it, right? Mm-hmm. We talk about microaggressions all the time. I was on a podcast. I was lucky to be on a webinar. Tech UK were talking about diversity, and I asked, why is it that Filipino nurses are dying, right? Why is it the Black experience worse? Let's face it, South Asians, like myself, I'm from Bangladesh ethnically, we're overrepresented in health and care. The Black experience is worse. I don't think the BAME name actually is that useful. And I think that's valuable to say, right? Unless you hear people saying it, it's not acceptable to say it. So let's say it.
No, I really agree. I'm glad Mandy chipped in, because I was just going to talk about how concerned I was about going for like the donuts first in meetings. You made a far more useful and productive point.
There's a way of doing it.
Well, I love those that you saved that and said it anyway. Thanks today.
Honestly, I have.
Hassan, I think a massive part of what you're saying stems back from integrity, right? Because at the end of the day, the things that you're talking about, the experiences you're talking about, come from not really much of a scientific or logical appraisal of what's going on, but what you are as a person and who you are as a person. It's not that you in that situation thought, how could I be a better leader, or how could I do things better for the team? You just looked at what was happening, decided you didn't like it because it was fundamentally wrong, and decided to do something about it. And I think this is something that I really struggle with, because I think that I work mainly in the NHS, and I think that a lot of the time in the NHS we follow guidelines and follow things because they're the things that the hospital has said you must do, or that your department has said you must do. And sometimes we forget to just take a step back and think about what's going on in the situation. Is it right or wrong? And what should I be doing about it? And I don't know if that's the same thing that you find in your work. Do you find that your colleagues are not always able to say, hang on, is this right or wrong, and what do I do about it?
So a bit of background might help here. So I'm a former social worker, so for older people in Hackney. So I was there when they went bankrupt in the early 2000s. That wasn't my fault. I was at Bart's at the Royal London when the Sun and Millennium rollout went wrong and we lost all of the 18-week clock starts. Again, that wasn't my fault. And my career is full of being there at the wrong time, repeatedly, and being part of the team trying to save things. Right? When I was at Hackney Social Services, we weren't allowed to do something where we'd send people to knock on the door to see if people were still alive. So I would apply and bid for Meals on Wheels for older people who didn't need the food. Because if they knocked for your Meals on Wheels and they didn't open the door, you'd get a notification. So my career in health and social care, whether that's data or not, has been trying to do workarounds in the system because I didn't have any seniority. There wasn't a position for me to say, no, this is wrong. When there was bullying going on at social services, I remember black staff were being promoted to bully black staff. This is what was going on in Hackney at the time. And I didn't have the leverage, the authority, the power to say much. Otherwise, I'd have just been bullied myself and lost my job. So I'm now in a situation very different to 20 years ago, where I don't think those things would have been accepted in the same way. But I do think you've got to be brave. You've got to consider the limits of your power and how to do something that's actually going to make a difference. How can you raise the issue? But I've gone through situations in my career where I look back and I think, I wish I could have done something at that time. I really do. And therefore, when I look at the situation for us now today, I think there are avenues for us to speak out when things are wrong. But they weren't always available to us. And there's still bullying going on today. There is bullying in the NHS, there's bullying in health and social care. So leaders need to make it easy for people to raise those issues. They need to listen. And we shouldn't need whistleblowers. But now we do have this whole category of people you'd call whistleblowers. And they're special people because they're the ones that decided to speak out and everyone else didn't. It's unacceptable in my view.
I think it's a really powerful statement because those are a group of people that are either respected and revered by some, or I've heard some horror stories about people who have whistleblown and who have spent months, if not years, in long drawn out processes to try and settle whatever it was that they had pointed out. And the one thing that is always in common in those cases is that the reason for coming up with whatever they came up with was for people's safety and to help people and to save people in many situations. And I think it's a powerful thing to say. We shouldn't need them. Absolutely.
And I think it's really reminiscent of that story you told earlier, right? About the leader who became the leader because they stood between. So from above, there is the drawn out processes, the hard work, the difficulty. But then from the people who are deemed as below, I'm using hierarchical language, unfortunately, I'm sorry. But the people who are deemed as below, they are the leader. They are the people that they look to for help, and how that theme being constant and constantly running through.
Well, so let's look at HLA. Sorry, Tim.
No, it's okay. It's something that I wanted to, because I feel like, I don't know if this is intentional or you're aware of it, I'm sure you are, that your ethos to me seems to be about the leader as sort of as culture maker. Sort of interspersed through all of the answers to your questions, it's been about how do we create the culture that allows us to do the thing we want to do. Like, we're here to do this thing, but we have to create the culture. And I was wondering, how does that connect to actually ensuring we have like that proper digital integration in NHS services? How do we create the culture that gets rid of those blockers and things that you were referring to earlier?
So, and very perceptive, by the way, thank you. The argument for me is to do with either one of two approaches. Either you have a genius with 1,000 helpers, right? And therefore that genius is the one that does everything and everyone else has to just follow. Or you have the servant leader who lifts everyone up, removes the blockers for them, clears the obstacles, makes things easy for them, and just constantly fights on their behalf to help them be authentically themselves and be better versions of themselves in service of the mission. If you understand that there isn't a middle ground, you will either end up one or the other. You have no choice but to move to the servant leader model and to examine whether you are humble enough but confident enough. Because there's a curious mix. If you tell me repeatedly tonight that I'm wrong to my face and that I know nothing and I'm absolutely rubbish at this stuff, and I'm still smiling and saying, great, you do it. It's fine. Here's a budget. There's a task. Here's the critical success factors. I need to meet you every Tuesday at 2 o'clock to go through it. Is that all right? What do you say tonight? You up for it? I need to be confident enough that it doesn't matter that I don't know your job. I couldn't care less.
Yeah.
But we can get there. So there's a curious mix, right? And therefore only a few people deserve to be leaders. But you're never going to make it if you don't have strength of ideas, you're not brave, you're not the kind of person that can take criticism. So you need a bit of a thick skin. Are you the kind of person that can inspire others? If you can't inspire people, you're not going to be a great leader. Can you see when someone's having a difficult time? Maybe problems at home, right? So at that moment, do you push that person even harder? Or do you give them a chance? Do you listen to them? Are you approachable? What if you're having a bad day? Do you take that to the office? I tell you what, being a leader, being a good leader, is very, very difficult. I'm the first to say I'm a terrible leader. I don't think I am. I am very good. But I know where I want to get to. Right? And I'd like to think in this conversation, we've covered some of those points. Culture maker, absolutely. But look carefully at yourself. Look in the mirror and ask yourself, am I doing this for the right reasons? Is this about me or is this about the mission? And maybe that will help you see whether you should be a leader.
Mr. Chaudhury, thank you so much for joining us for this episode. I think that's an excellent way to close the episode. Thank you so much for your time. Thank you so much for your wisdom. And I'm sure that we will talk again. Thank you so much. Appreciate it.
I'd like that. Thanks, guys. Good luck.
Thank you so, honestly, it's so great listening. Forgot about half my questions just listening to you say wise things, Hassan.
No, it was amazing. Thank you so much for your time.